talk to you guys today about two of the most common conditions that we see in the clinic here. You may or may not have heard of them. The first one is upper cross syndrome, and then the second being lower cross syndrome. So let's talk about upper cross syndrome first, what it is, how we treat it, and what we do in the clinic here for it. So upper cross syndrome, super common, especially with the society that we live in. A lot of us are sitting at desks, typing notes, we're slouching like this, we have poor posture, and what that does over time is it causes certain muscles to become tight and other muscles to become weak. So in upper cross syndrome, the muscles that are tight are your upper traps and your pecs. So pec minor and pec major. And the muscles that are weak are your cervical flexors and your rhomboids, those muscles right in between your shoulder blades. So let's talk about how we treat those weak muscles first. So there's a couple exercises that we tell all of our patients to do at home. And if you are one of my patients, you know that I absolutely love to prescribe these for you to do throughout your day to help you get rid of upper cross syndrome. So the first exercise I'm going to show you is called cervical retractions. And what these are is, it kind of sounds silly, it kind of looks silly, but basically what you want to do is try and give yourself a double chin. And what this looks like, I'll just turn to my side here, showing my vulnerable side. So you're going to take your chin and just tuck it back, just like that. I like to put my fingers on my chin just as a reminder to really go back to that full cervical flexion. And what that exercise is doing is it's strengthening those little bitty cervical flexors in our neck that don't get a lot of love. So generally speaking, I'll say do 3 sets of 10 of these throughout your day for breakfast, lunch, and dinner. The next exercise I want to show you is going to be strengthening those weak rhomboids in the back. So this exercise, what you do is you start with your thumbs facing to the back like this, and you're going to envision as if you have a pencil right here in between your scapula or your shoulder blades. And what you want to do is you want to squeeze those muscles in the back, envision pinching that pencil as if you're trying to prevent it from falling to the ground. So it'll look like this. Hold for about 3 seconds when you squeeze and contract in the back. 3, 2, 1, relax, and again. 3, 2, 1, relax. And you'll notice as you're doing those exercises, you'll feel your chest open in the front, you'll feel those muscles working in the back, and it's just helping you to obtain a better posture for your upper body. Okay, so just to recap the exercises, it's cervical retractions, double chin, and the shoulder retraction exercises, trying to pinch that pencil in the back, okay? So, as I mentioned earlier, those are the weak muscles, and then we also have super, super tight muscles in upper cross syndrome. So the tight muscles that we're dealing with are the pecs and the upper traps. I'm going to show you how to stretch your pecs out. Now, disclaimer, there's probably about 100 ways that you can stretch out these muscles in the front. I'm just going to show you a couple of my favorite ways to do it. So for me personally, what I like to do is lace my fingers in the back like this, extend my elbows, and open my chest just like this. So you'll notice I kind of straighten my arms out in the back, and what that does is it really opens up your chest in the front, stretches those pec muscles out. Now if you don't have the mobility to get both of your hands behind your back and able to lace your fingers like that, totally okay. There's a really good door frame stretch that you can do for your pecs. So let me show you. Hopefully I'll stay in the frame here. So what you do with this is you make a right angle with your arm. You go into the door frame like this. Oh, hold on. I got this. Yeah, okay. So 90-degree angle, the elbow. What you do, you're gonna lean forward. And what you're gonna do is you're gonna feel that stretch all in the front of your shoulder here. So for all stretches, we suggest that you hold them for about 30 seconds because that's when you're going to get the most elasticity, or you're gonna feel and get the best benefits from those stretches. Okay, so just to recap, you can do the laces in the back, lace your fingers in the back, open the chest, or you can do the door frame stretch. You can also do that at the same time if you want to get both at the same time and save yourself some time. Okay? So the next stretch I want to tell you is for those upper trap muscles. I find a lot, especially with females, we tend to carry, I know I do, we tend to carry our stress up in here. So this is by far one of my favorite stretches that you can do at home. just to show yourself a little bit of self-love and care, and we definitely need that after the year we've had. So for this stretch, what you're going to do is I'm going to show you, so I'm going to stretch this side first, okay? So I'm going to take my right elbow in my right hand, and I'm going to gently cup it right across my ear, okay? And then I'm gently going to pull my ear down, my right ear to my right shoulder, just like this. Oh, it feels so good. I'm gonna hold that for 30 seconds, okay? And if you're feeling like this isn't enough stretch for you, you can make it a little more challenging by taking the opposite arm and putting it behind as if you're trying to stick it into your pocket. So it'll look like this. Oh yeah. And I'll show you just like this. Again, you want to hold these for about 30 seconds, and you should feel a nice stretch all along this upper trap over here. So to recap about upper cross syndrome, we have tight pecs, we have tight upper trap muscles, we have weak cervical flexors, and we have weak rhomboids in the back. So those are the 4 muscles that we really want to target. And of course, if you guys have any questions about upper cross syndrome, give me a call. I'm Dr. Kayla at Henderson Wellness Center. It's 252-430-8000, and I'd love to help walk you through some of these exercises that you can do at home. So the next syndrome I want to talk to you guys about is lower cross syndrome. So it's kind of the same concept of that we have tight muscles in some places and weak muscles in other places, but now we're just applying that to the lower body. So again, upper cross syndrome is super common because a lot of us sit at desks. I know I'm guilty of it, doing notes. Our posture starts to slump, or when we're standing, these shoulders kind of roll forward. And what goes along with that is you're sitting at a desk. So now, if we're sitting in a chair, these muscles in the front are getting shortened or tight, and the muscles in the back are getting weak. So what we're going to do now is target the weak muscles, strengthen them, and we're going to stretch the tight muscles. So let's go over the tight muscles first. So the tight muscles in lower cross syndrome are your iliopsoas, or those hip flexor muscles, okay? And your lumbar paraspinal muscles, which are muscles that run parallel with your spine, or those muscles that run on either side of your spine in the back, okay? So what happens with a lot of patients with chronic low back pain is those lumbar paraspinals will get super, super tight because the muscles that should be working aren't working at the time, okay? So and what I mean by that is the weak muscles in lower cross syndrome are your glutes, or your butt muscles, which are supposed to be super, super strong because it's a really big muscle group. And what happens with low back pain is since our glutes aren't working, our lumbar paraspinal muscles take over and go into overdrive. So these exercises and stretches are geared at getting our glutes to work so we can take off some of the pressure of those lumbar paraspinal muscles. Okay? So I didn't mention the next weak muscle group in lower cross syndrome, but those are your core muscles. And when I say core muscles, I'm not talking about, you know, that rectus abdominis, that washboard six-pack abs that Dr. Taylor wishes he had. I'm talking about those little tiny core muscles that stabilize the spine that don't get a lot of love. So these muscles are like multifidus, transverse abdominis, probably muscles that you're unfamiliar with, that generally get turned off. So some of these exercises I'm going to show you are geared at turning those guys on and getting them working again, okay? So to kind of go back for those tight muscles, so remember, our tight muscles are our iliopsoas, or our hip flexors in the front, and the lumbar paraspinal muscles. So the first, I want to show you how to stretch those hip flexor muscles first. So one of the easiest ways to do this is called the runner stretch. So what you're going to do here, let me angle this down a little bit, is you're going to go into a lunge position. Here, let me rotate this way. Just like this. So now this would be me stretching the knee that is down on the ground, okay? So what you're going to do with this is you're going to kind of walk this front foot out, trying to keep your knee behind your toes when you lean forward. And you'll feel, ooh, I'm a little tight, guys, I need this one. So you'll feel that stretch right in the front of your hip here. If this isn't challenging enough for you, what you can do from here is you can put your arms up and rotate and lean away from the side that you're stretching. So this will just deepen the strength because it puts those muscles a little bit more on tension, and it'll give you a deeper, sometimes more uncomfortable stretch, but sometimes we need it. So just like this, again, you gotta hold that for 30 seconds. And still, I have another progression for some of you people out there that are like, oh, Kayla, that's still too easy for me. So while you're leaning forward in this position, to really make this challenging, yogis, you'll really appreciate this is you're gonna bend this knee in the back and point your toes just like this, okay? And if you really wanna get that balance and core going, you can still put your arms up, rotate, and lean away. And you'll really deepen that stretch in the front, okay? So again, that will be 30 seconds, both sides. Do that for breakfast, lunch, and dinner and throughout your day. The next muscle group that we want to target, again, iliopsoas, or those hip flexors, and the lumbar paraspinals are tight in individuals with lower cross syndrome. So the best way to stretch these lumbar paraspinals, in my opinion, is child's pose. So I don't know how familiar you are with yoga, but I'm a big fan of yoga, especially when it comes to stretching exercises. So child's pose is you're on the floor, you sit back on your heels like this, and what you're going to do is you're just going to really focus on, here, let me pull this hair back. You're going to try and let your sternum sink to the floor, and you're going to reach out with your hands just like this. So what I'm focusing on here is one, I'm really trying to focus on my breathing. So I'm taking big diaphragm breaths. And every time I do that, I'm letting my head kind of sink between my shoulder blades a little further. So the goal is to eventually get your forehead touching the floor. And you'll notice I'm kind of using my fingers to crawl forward and out. And you'll feel stretched the whole way from your shoulder blades all the way down to your low back if these muscles are tight on you. Another variation you can do with this is if you have like a table leg or a chair leg in front of you, if you really want to target stretching one side versus the other, let me scoot back. You can reach out and try and imagine I'm reaching for a table over here, a table leg. So you gotta reach over and I'd be grabbing that, again, trying to sink my head to the floor, letting those shoulders fall. I'm getting a stretch all the way down this right paraspinal, focusing on those lumbar paraspinals. You can also do that just going the other way as well. I recommend doing the straightforward to start out with, if that feels pretty relatively easy, then advancing to going each individual side. Okay? So, recap, we have that runner stretch for the iliopsoas, and we have that lumbar paraspinal stretch. The next thing we want to do is we want to target those muscles that are weak, right? So we need to do some exercises for those core stabilizer muscles, and as well as getting these glutes to work to take off some of that load of the low back muscles, okay? So let's start. This is also one of my favorite exercises. Some of my patients, if you're watching, you know I'm like the world's largest fan of glute bridges. So what this exercise is aimed at doing is getting these glutes to fire and to get our hips to extend. And what I mean with hip extension is this movement. So it's a very minute movement going back. That should be our glutes working to do that. So anytime that we're going back here, our glutes should be the first muscle to fire in that pattern, okay? A lot of times what will happen is if we go to extend our leg or this low back, these muscles will take over and we're bending like this and firing these muscles here instead of these big muscles here. So this is more of a, let's call it trying to get away from glute inhibition, which means those muscles are turned off, and we're trying to reestablish some motor control to those glutes. So what you're gonna do is you're gonna lie on the floor, just like this, arms by your side, feet flat on the floor. You're gonna feel your pelvis. You wanna try and get in that pelvic neutral position. And what you're gonna do is, this is a very conscious exercise, and what I mean by that is you're going to say, all right, I want to squeeze my glutes. I gotta squeeze my butt That should be my first movement, coming from here and not arching my back and lifting with those muscles in the back. So what this looks like is with your feet on the floor, hands by your side. I'm going to squeeze my glutes, go all the way up, and lock out in hip extension here, okay? I'm going to hold for 3 seconds and go right back down. Let me show you that one more time. So squeeze, 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 lift with those glutes, lock out at the top, nice and slow and controlled on the way down. Some tricks and things to remember when doing these is your feet should stay flat on the ground, and one of the most common mistakes you can make with the glute bridge is not locking out your hips at the top. So it's really important that you get to terminal hip extension. So a lot of times people will go right here when we're really looking for this, okay? So that's the first exercise. The next exercise I'm going to show is for strengthening some of those core muscles, those deep core muscles. And there's a lot of research that supports bird dogs and dead bugs. Again, if you're one of my patients, you've heard these a lot. So these exercises are 2 of my favorites. So let's start with the dead bug. Bear with me here. So you're gonna be on the ground again, and it's really nice. Look, you can just go from your glute bridges right into your dead bugs, right? All about convenience here. So what you're gonna do with this is your arms are gonna go straight above your head. Your knees will be bent to 90 degrees, hips will be bent to 90 degrees, and your feet will also be bent to 90 degrees, okay? Just like this. And what this exercise's main goal is to establish control of your core, to stabilize your spine while moving your extremities, okay? So what you're gonna do here is I'm going to extend my right leg and my left arm in an opposite pattern. So it'll look like this. Notice how it's very slow and controlled. Good. You guys like how I just complimented myself there? Okay, so again, this is super slow and controlled exercise. It's aimed for reestablishing some core control. You want to extend opposite arm, opposite leg, and you want to make sure that when you're extending, let's say like I'm extending my right leg and left arm, that my left leg and right arm still maintain their position. So a lot of times what we'll see in our patients here doing these exercises is, so let's say this is what it should look like, right? So we'll see like sometimes an arm will go down with that leg and you'll kind of go like this, or this knee will kind of droop like this. And I am a big fan, quality over quantity, guys. If you can't do this exercise correctly, it's really not worth doing at all. That can just create risk factors for injury, and you're really not getting a whole lot of big gain out of it. So the next exercise I want to show you for the core, only because they're my favorite, it's called bird dog. So a bird dog is kind of similar to a dead bug, but now instead of being on your back in that dead bug position, you're going to be in the quadruped position with wrists under your shoulders, knees under your hips, just like this. Okay, so notice I have a neutral spine here, and when I'm doing this exercise, I want to picture it as if I have like an apple or a small ball on my low back here, so that it won't fall off. So wrists under shoulder, knees under hips. What I'm going to do, just like the dead bug, is I'm going to extend opposite arm and leg. So in this neutral spine, you see I'm going to extend my right arm and my left leg and bring that right back in. And then left arm, right leg, right back in. Notice I'm keeping my pelvis pretty level. I'm by no means perfect, but what you don't want to see is whenever you go out, you don't want to rotate like this. It should be a very conscious movement, squeezing with that glute to extend that leg and reaching forward with your arm, keeping your chest straight, square with the ground. So I always say do 12 of these total. So you'll do 1, 2, 3, all the way up to 12. So you're doing 6 each side. Same with the dead bugs. And then 3 sets of 12 of the glute bridges. They're a little easier to do just because the glutes are a bigger muscle group, so they have a little more stamina. But yeah, so this is our quick, easy presentation on upper cross and lower cross syndrome. Again, guys, I'm Dr. Kayla. I love doing rehab, so if you're interested in learning more about exercises or what you can do at home to help maintain spinal health, please give me a call, 252-430-8000, and I'd love to join you on your journey to a happy and healthier you. All right, guys, take care.